Kissiedu Antiri, currently working in the Korle-bu Teaching Hospital, the Department of Internal Medicine. I made this video during my audits, the title being Documentation and Correct Usage of Anti-embolic Stockings. The main aim of this video is to educate medical practitioners and the nurses concerning the correct usage of anti-embolic stockings. The important things that one needs to know when using anti-embolic stockings, and then whether it has been correctly documented. Basically, venous thromboembolism comprises two things. We have the deep venous thrombosis and then the pulmonary embolism. The venous thrombosis occurs when you have the formation of the clots within the veins of commonly the legs. Then you have pulmonary embolism occurring when the clots within the veins, the swelling moves through the veins up into the lungs to open the vessels to the lungs, causing pulmonary embolism. Every year, about 10 million cases of venous thromboembolism is recorded. In the US, about 200,000 to 300,000 VTE, which is the venous thromboembolism related death, occur every year. And then for Europe, it's about 544,000 VTE related deaths occur in Europe. For Black African countries and Ghana as a whole, we don't have exact figures currently. So why do we really need to apply anti-embolic stockings? We need to apply anti-embolic stockings because venous thromboembolism is a potentially preventable medical condition and a fatal medical condition when it occurs. The mechanism of action for anti-embolic stockings include it's providing a graduated circumferential pressure which promotes which promotes venous return by increasing the blood flow velocity. It also prevents over distension of veins or distension of veins, hence decreasing subendothelial tears and decreasing the activation of clotting factors, hence we end up decreasing the formation of the thrombus. There are so many indications for the application of anti-embolic stockings, but the common one that we most use for on our wards is when a patient is immobile, or you have a patient who you suspect to be immobile for a period of more than 3 days. Other indications include when a patient has cancer or is on active treatment for cancer, age more than 60 years, and when the patient who is obese, more than 30 kilograms per meter square. There are several indications, but these are the few that I'll mention. There are also several contraindications why you shouldn't apply anti-embolic stockings to the patient. Some of them include when the patient has obvious peripheral arterial disease, the legs are pulseless, they are pale, you shouldn't apply anti-embolic stockings. Also, when the patient has severe peripheral neuropathy, especially in patients with diabetes mellitus. Other contraindications include when the patient has severe leg deformities, also when the patient has undergone a recent skin grafting. To say anti-embolic stockings are good, yes, they are very good, but there could also be some side effects or adverse effects, especially when they are not well applied. And what are some of these adverse effects that these anti-embolic stockings could bring about? They include arterial thrombosis, as has been recorded in the British Medical Journal several years ago, on the 5th of September 1987, published in the British Medical Journal, as I said, volume 295, page 580, if you'd like to read about these two cases of arterial thrombosis. The other risk factors include dermatitis, irritation to the skin, pain, and then some form of discomfort, especially when they are not applied appropriately. What are some of the things that are needed when we want to apply an anti-embolic stockings? The things that we need include a tape measure. We also need a checklist. So if you can kindly come in. So we need a tape measure. We need a checklist, and for the checklist, what's on the checklist is the various examinations that you need to do when a patient comes in. You need to assess the patient, check for color, check for warmth, and then record everything that the patient has. Whether the patient has it or not, you tick. So if the patient has any warmth, you tick. If the patient doesn't have, you tick. And you also rule out any contraindications. So this is the second item that you need, and then the third item you need is the charts. The charts. It's not very necessary to have the chart because the chart varies across various pharmacies. But if in case our pharmacy uses the same charts, then we can be able to measure the calf circumference and the length, and also choose the size for the patient. But if you don't know the pharmacy that the patient will be sending the prescription form to, you just need to state the calf circumference and then the length. Then the patient will send it to the pharmacy and purchase it. So these are the things that we need when we want to apply an anti-embolic stockings. And of course, you need to have an anti-embolic stockings itself. You need to prescribe for 2 pairs because when one is being washed, the other one will be used. What are some of the things that you have to remember when you want to apply anti-embolic stockings? There are 5 things that you need to remember when you want to apply anti-embolic stockings. 3 apply to both knee and the thigh length stockings, and then 2 is restricted for just the thigh anti-embolic stockings. So for the knee length, the first thing that we need to know is that we need to remember that there is a part of the stocking called the heel pockets. This is the heel pockets. The box here is the heel pocket. So you need to make sure that it's in place because it adds up to a good therapeutic effect. Apart from the heel pockets, the second thing that you need to know is that the stockings has 2 parts. We have the rough part, which is outside, and then the smooth part, which is inside. So in wearing or in applying these anti-embolic stockings, we need to make sure that the smooth part goes close to the skin while the rough part is on the outside. The third thing that we need to remember is that once we put anti-embolic stockings on the patient, we need to smoothen out any wrinkles that are on the anti-embolic stockings. The fourth and fifth things that are related to the thigh stockings is the gusset and then the stitch change, which will be explained in the slides that are attached to this video. So for the procedure, before anti-embolic stockings are applied, you first need to explain the procedure to the patient, which I've already done. The patient has agreed about supervision. I've ensured there's enough privacy. Once I have this, I wash my hands, which I've already done. After washing my hands, the next thing I have to do is I have to measure the lower limb. And in measuring, it depends on the type of anti-embolic stocking that you want to prescribe for the patient. Commonly on our wards, we prescribe the knee length anti-embolic stockings. So with the knee length anti-embolic stockings, all that you need is the length of the leg from the heel to the bend of the knee. But importantly, the position that the patient needs to be in when checking for these measurements is either the patient is sitting down or standing. The patient shouldn't be lying down, because when the patient lies down, it gives an incorrect calf diameter. So when you want to check the calf diameter, you should make sure the patient's knee is bent once the patient is immobile. So I'll start by measuring, because we are doing a knee length stocking, I'll start by measuring from the bend of the knee to the heel. I'll place my measure here. It's the bend of the knee. So to the bend of the knee, which is about 41 centimeters. Once I have this, I'll then go ahead to measure the calf circumference. So as I said, you don't have to measure with the patient lying down. So you bend the knee, then measure at the widest circumference. So with this, I have a measurement of 31 cm. This is for knee length stockings. But if you want to use a thigh length stocking, then you have to measure from the heel to the gluteal flow, which we can see here. The gluteal flow is around the side, just the fold beneath the gluteus maximus, that's the gluteal flow. And then we measure the thigh circumference, which is the widest part of the thigh, for the measurements. So basically these are for the measurements when you want to prescribe an anti-embolic stockings. Once you have these measurements, you state it on the prescription part. So I'll state that I have a calf circumference of this and then a length of this on the prescription, so that the pharmacist will be able to prescribe the appropriate size of stockings for the left lower limb, and then I do the same too also for the right lower limb. After I've measured, the patient has gone, or the carer, once the patient is mobile, the carer has gone, reaches the stockings, has brought the stockings. Once the stockings is in, I need to don my glove to facilitate easy wearing of the stockings. So I wear my gloves. I tell the patient I'm going to put the stockings on. Now, actually, they show why. So the patient has agreed. Before I'll fit the stocking, I need to insert my hand into the stocking and reach for the heel pockets. Unfortunately, it's inappropriate for the leg, so we might have a little bit of difficulty putting the stocking on, but we'll still go ahead and fit it. So I put my hand in as far as the heel pockets. So I go in the heel pockets. So I go in as far as the heel pockets. And then grasp the center of the heel pockets like this. Once my hand is in, and then I turn it inside out. So I have something like this. Then once I turn it inside out, I'll put the stocking over the foot. So in this way. Like a fry. So I need to I do this, now my heel is within the heel pocket. So that's the first thing I need to make sure. I do this in the heel pocket. Then I run the turned part of the stockings over the toe, over the ankle, along the calf, up to the appropriate position. So this is the second important thing that I'm doing. You need to smoothen out any wrinkles. Make sure it's smooth enough. I have my heel in the heel pockets. I'm smoothing out any wrinkles. The smooth part of the stockings is close to the skin, and the rough part is outside. And then one thing about the new stockings is that it should be about 4 to 5 centimeters, which are about 2 inches just below the knee. You shouldn't get to the knee, you shouldn't stay above the knee. But because the length of this stocking was not correctly measured, you can see there is still a little bit of material just folded here, which shouldn't be the case. It should end about 2 inches below the knee. So if we leave it this way, it could cause some tourniquet effects. That's will decrease blood supply to the distal part of the limb and cause ischemia. So we need to go ahead and run it over just to make sure we don't have any tourniquet effects. So once we've fitted it in this way, we need to make sure that we examine the limbs about twice a day to ensure the stocking is not causing any tourniquet effect, it's not causing any form of irritation. We ask the patient if there's any pain or discomfort. If the patient can't talk, we need to take the stocking and re-examine, make sure there's no edema, whether the indication for the stocking has changed, whether we need to take it off or what. Also, we need to also make sure that the stockings should be changed every 2 to 3 days, and also when soiled. That's why I prescribe repairs. The next thing that we also have to know is that once the stocking is taken off, the stocking should be worn 24 hours a day. And once it's taken off, we need to take it off for a period of just 30 minutes, because the effect of promoting blood flow velocity up into the heart will decrease once the stockings are removed for a longer period of time, which is more than 30 minutes. We also need to explain to the caregivers about managing the stockings. They should take very good care of the stockings, make sure it's not always swelled, clean it twice, clean it every 2 to 3 days, and again, as I said, making sure you don't take the stockings off for more than 30 minutes. Thank you for watching this video. A big thank you to Professor Ekem, who is my supervisor, giving me the idea to do my own video. Then thank you finally also to the cameraman, who is a medical doctor, David Christiansen. Thank you very much.